Malaria elimination activities, supportive supervision feedback for district, PHCU and other concerned bodies. July 20 up to 30 Harar. Presentation content is 1. Introduction about malaria elimination, 2 slides. 2. Objective and the goal of malaria elimination, 3 slides. 3. Highlights of achievement, 3 slides. 4. Actual supervision finding feedback, 6 slides. Major common strengths, 1 slide. Major common weakness or problems, 4 slides. Possible reasons of malaria case rising, 1 slide. 5. Way forward or correction orientation, 2 slides. 6. Monitoring and evaluation focus area at health facility, 1 slide. 7 slides key points helps for capacity building of staff, 60 slides. Introduction or highlight about malaria and malaria elimination. Malaria is one of vector-borne communicable disease. It is a pandemic and disease of all segment or level of human being. Malaria is transmitted by the bite of infected female Anopheles mosquito. Malaria can be prevented, controlled and eliminated through continuous integrated intervention of different stakeholders, effective activities. Even though it is pandemic, most of Western countries have been eliminated. However, it is continued being major health problem in the rest continents. In our case, the actual condition of malaria transmission is on rising. That means malaria trend is on increasing above zonal threshold. Based on this fact, we conduct supportive supervision to identify the major gaps and the possible reason for rising the malaria case. The finding will be presented as follows. Objective. By the end of this presentation, participants will get good awareness on malaria and its actual conditions that help them to get the highlight of actual figures, malaria morbidity and mortality, to identify reasons for increasing malaria case and outbreak. 3. To fill the identified gaps so as to overcome the problem. To identify for areas need collaboration or stakeholders support. To identify the role of district PHCU and the other staffs. To determine the way forward to invert the actual condition. And finally, to achieve the main objective of malaria elimination program. Program milestones. Vision, malaria-free Ethiopia. Goal, eliminate malaria nationwide by 2030. Objective, reduce malaria case incidence or mortality to 0 by 2030. Reduce malaria mortality rate to 0 by 2030. Prevent re-establishment of malaria in all malaria-free districts. Strategies, objectives for 2025 based on National Strategy Plan 2021 up to 2025. 1. 85% households behaviors and practices towards anti-malaria interventions. 2. 100% confirmatory testing of suspected malaria case and treat. 3. 100% of population at risk. Globally recommended vector control interventions. 4. District with API less than 10 case and FOSI investigation. Classification and response. 5. Generate 100% evidence for appropriate decision making. 6. Capacity building to coordinate and implement malaria elimination interventions. Zonal malaria situation and performed activity report. Test, sex, and age disaggregate of confirmed cases. Total test 10, 8, 7, 5, 8 by passive 64011 and by active search 44747. Total confirmed case 45, 4527. 3899 passive 628. Secondary case by residual active case detection. When we see sex population, 58% of zonal cases were confirmed as male. Age disaggregate of confirmed cases, 61% were greater than 50 years, 28% were equals to 5 to 14 years age, and 1-2% were under 5 years of age. Parasites, 89% of cases were Plasmodium falciparum. Test positivity rate is 4%. Burden, greater than 80% of zonal localities were malarious, and 80% of zonal population were live in malaria risk area. Aggravating factors: irrigation, population dynamicity. Zonal malaria case management trend. Total examined in number and the total confirmed cases looks like this in the diagram. Major identified findings on monitoring and evaluation. Major common strengths: most of visited health facilities were testing and treating malaria case as of standard. Most of health facilities were the health center and the health post were undertaking malaria case and FOC investigation, classification, and response. All visited health facilities were the health center and health post were received and distributed to any 15. Long-lasting insect nets. Most of visited households have received long-lasting insect nest and utilization. All staff are aware of malaria elimination strategy objectives and committed to implement. Most of visited health centers have functional laboratory. Almost all health facilities have tools and materials needed for data recording and reporting. Major common gaps identified. Data quality problem. Most of health facilities. Data inconsistency remains a challenge. FEM, DHIS, and FTAT. The FEM and FTAT report availability, timeliness, completeness, and accuracy of health facilities that did not monitor as to standard. Health workers do not value data as an important component of malaria elimination. Unexpected malaria case rising and mismanagement at some health facilities. Weakness of linkage between district health office, PHCU, and health post. Points listed as evidence are: gap on monitoring chart utilization, piloting, updating, gap on LLINS distribution related documents registration, no framework for monitoring or supportive supervision, and also not practiced, poor feedback for identified gaps in the compliance system. Evidence for data discrepancy between DHIS and the weekly report looks like on this chart. Possible reasons for such abnormal conditions: external factors, occurrence of abnormal global weather condition, increasing development, example use of irrigation, population dynamicity, weak collaboration and stakeholder support, shortage of logistics for supportive supervision, and shortage on basic supplies, RDT, LL, INS, drugs, reagent, and etc. Internal factors, gaps on continuous supportive supervision and follow-up, gaps on data quality and time report, gaps on timely analyzing and correctly interpreting obtained data. Example, data not analyzed properly and piloted on malaria monitoring chart. Negligence of timely using data for action. Shortage as well as poor utilization of distributed LL and S. Lower awareness of community on long-lasting insect net utilization and engagement on larva source management. Low attention of all level concerned bodies. The way forward, all concerned body should give attention and do what is expected of them. Concerning health sector, different level leaders and workers should check and fulfill all gaps identified on the following activities or supplies. Package of activities or tools needed for data quality, availability of all expected properties, timeliness, completeness, accuracy of report, availability of all tools needed for malaria intervention activities. Example, all registers, checklist for supervision, report formats, monitoring chart booklet, and the like. Availability of all needed materials used for plant intervention, long-lasting insect nets, drugs, reagents, and the like. Conduct regular supportive supervision by using proper checklist according to the level of health facility. Fill gaps on capacity building for concerned staff on the topics such as how to use booklet for malaria case diagnosing and recording books, protocol for case management to enable them correct treatment, how to record analyze data and pilot on monitoring chart, how to identify and using proper intervention method to follow the proper malaria surveillance method, etc. Continuous follow-up of district PHCU or leaders on how those trained staffs are practicing what they know, advocating leaders to get needed support and attention, mobilize community on how to use long-lasting insect nets properly and to engage them on environmental management for larva source management. Monitoring and evaluation. Monitoring and evaluation are key activities to achieve main goal. Therefore, all concerned bodies should conduct regular monitoring and evaluation as to malaria elimination guidelines. Measure monitoring and evaluation activities at facility levels, case register, case reporting, case investigation, focus investigation. Each health facility should undertake the minimum data analysis and standard graphs. Monitoring and evaluation framework. Malaria monitoring and evaluation framework and illustration data types looks like this. Assessment planning, input, process, output, outcomes, impact. Some slides that helps for capacity building of health staffs on topics related to malaria elimination in the context of the new national guidelines, case management, list of tools needed at health facility, health center and health post, types of report expected at health facility and source of data, steps to help how to plot graph on monitoring chart. Malaria elimination in the context of new national strategy program. This is malaria endemicity high. Malaria strata or classification API greater than or equals to 50. Moderate API greater than or equals to 10 and less than 50. Low API greater than 5 and less than 10. Very low API greater than 0 and less than or equals to 5. Free API equals to 0. Malaria case management protocol microscope result. Positive for PF, ACT plus single dose primaquine. Positive for Plasmodium vivax, chloroquine plus primaquine for 14 days. Mixed infection, quartam plus primaquine for 14 days. No blood film for high-risk patients, quartam plus single dose primaquine. Situations. Alternative treatment. Situation. Recommendation. Situation. If not chloroquine available for Plasmodium vivax, use quartam. If quartam not available for Plasmodium falciparum or mixed infection, use DP or dihydroartemisinin piperquine. Chloroquine and quartam not available for Plasmodium vivax, use DP. List of tools to be available and monitored for malaria case investigation. At Health Post malaria register book, passive case detection form, screening form, household tracking form, household members, RACD registration form, weekly case investigation report form, post investigation classification reporting form, malaria monitoring chart. 2. At Health Center malaria case register, support supervisory form, malaria monitoring chart. List of source document for DHIS. These charts look on list of source document for DHIS report. Simple step to pilot monitoring chart. Read it deeply. Malaria monitoring chart. Malaria epidemic monitoring chart look like this. Thank you.